COVID-19, should Black doctors be doing more? This may get me into trouble, but here we go. First, there are many doctors, including Black doctors, who are providing clinical care to persons with the coronavirus at great risk to themselves, potentially putting their loved ones at risk. So let me start off by saying thank you. Your years of studying clinical practice didn't necessarily prepare you for the devastation and the loss of lives seen with this pandemic. Without the doctors, nurses, ancillary staff, many lives would be lost. However, once it became evident that Black persons who were initially rumored to be immune to COVID were actually being infected and dying at higher rates than others, you have to pause. You have to pause and wonder why. Is this from the playbook that says, if you're immune, then you can be exposed to greater risk? We can have you drive buses without personal protective gear, deliver groceries, stock supermarkets, and if you get sick, if you die, your lives are expendable. And could that be why the CDC, most states and counties have not been reporting these statistics? Because, as they say, numbers don't lie. It took 2 Black women to report on these health statistics and the disparities seen in this country. Disparities that are often dismissed as, simply based on bad personal choices. It took 2 Black women to report on the death rate and the disparities in Milwaukee and other areas to have Congress propose legislation that would now require the CDC to collect and publicly report the statistics. It took the former New York Health Commissioner, Mary Bassett, and the current Milwaukee Health Commissioner, Jean Cowlick, Black women, to acknowledge that racism in the U.S. is a public health crisis, something that the federal government has yet to do. But just maybe with this pandemic, there will be acknowledgement followed by actions to remedy the problem. So, should Black doctors be doing more than providing clinical care to persons like ourselves who are subjected daily to racist acts? And make no mistake, Black doctors are exposed to racist acts, just like the Florida Black doctor who was in front of his home, loading his van, preparing to do free testing for the COVID virus on the homeless population in his community, that was confronted and handcuffed by a police officer. Should that doctor do more than demand an apology? Should he call out the racism? As doctors, as Black people, we see, we experience, we know, individually and collectively, we need to get to the root causes and not limit ourselves to applying band-aids. So what can we do? I don't have all the answers, but I believe collectively that we do. We can start by deciding to speak up and speak out whenever we are witness to disparate care. Like Malcolm X said, a man or a woman who stands for nothing will fall for anything. Now, I am by no means trying to blame Black doctors. Most of us have succeeded in spite of the odds. We endured, we persisted, and are now fortunate to be in a position where we can make a difference. And we know, just by our presence, that often we give other Black people hope and a reason to trust in our healthcare system.